On the line with me this morning is Captain James Dickens, who's with the Department of Health and Human Services with the U.S. government. Captain Dickens, we welcome you to the 411 this morning.
Thank you. Thank you for the invitation.
Well, tell me a little bit about some of the challenges. I know that this week is considered minority screening, prevention / whatever week. Tell us what some of the challenges are, and I guess you could set this up by sharing just a little bit of your own background as well.
Sure. I'm a family nurse practitioner and a member of the American Association of Nurse Practitioners and an officer in the U.S. Public Health Service, where I serve as the Regional Minority Health Consultant for Region 6 for the U.S. Department of Health and Human Services. And this week is National Minority Cancer Awareness Week, as well as the National Minority Health Month. And the theme for Minority Health Month is Prevention is Power. And so with that, staying consistent with the National Minority Cancer Week, cancer is one of the leading causes of death among minority populations, specifically African American men and women. And when we talk about cancers for African American men, we are talking about prostate cancer, which accounts for about 31% of the deaths for African American men in terms of cancers, lung cancer, and colorectal cancer. And for our African American females, we're looking at breast cancer, which is about 32% of the deaths for individuals that have cancer, and as well as 11% for lung cancer and colorectal cancer, followed by colorectal cancer as well. And so the preventative things that we talk about that our African American men and women can do to decrease their risk for some of these types of cancers. Obviously, for men with prostate or men that want to reduce their risk for prostate CA or prostate cancer, we encourage them to exercise, maintain a healthy weight, decrease red meat and fatty foods, and eat plenty of fruits and vegetables daily. And again, for the colorectal cancer, it's across the board for men and women. Maintain a healthy weight, physical activity, and diet. Again, is one of the big things that we would certainly encourage them to do. And for women with breast cancer, we would encourage them to decrease alcohol intake. If they don't smoke, if they do smoke, stop, and if they don't smoke, don't start. And we would also include any of the alternative nicotine delivery devices for smoking, now the hookahs, the e-cigs, and things of that nature. And again, maintain their weight, exercise, and seek out your healthcare provider. And obviously, nurse practitioners are a key part of that, of those prevention strategies, where most of the nurse practitioners, or a great percentage of nurse practitioners, work in primary health care. And so we're a part of that prevention strategies and a part of your healthcare team as well.
I would imagine, Captain Dickens, one of the challenges goes along gender lines to an extent, right? That men, black or white, whatever our background may be, that sometimes our pride gets in the way in terms of going to see the doctor. So what's a good word for the fellows this morning? Because, we're not too thrilled about, some of those humiliating encounters maybe with a urologist or, you know what I'm talking about.
Well, I certainly do know what you're talking about. And from personal experiences, about 3 weeks ago, I had my first maiden voyage in terms of a colonoscopy, and I've been putting it off. And obviously, and I'm here to tell you, as a practicing nurse practitioner and a nurse for a number of years, and having graduated from the HBCU, I was not thrilled with that process. And let me tell you, it was painless. It was a painless process, and I went through the process with the gastroenterologist who performed the procedure, and I'm happy to say I have a clean bill of health. But it's certainly a process, particularly for African American men. We're a little hesitant to get what we call the DRE, our digital rectal exam, and so I certainly would encourage men to do it, and even talk to other men that have gone through this. There are advocacy groups and individuals that can give you additional information that may be helpful in helping you make that decision to get the screening exams that may save your life. And so I would certainly encourage that. And again, as I've said, Nurse practitioners are some, and having been trained as a nurse and being a nurse practitioner, we are certainly poised and ready to and positioned to provide that education and teaching and training for our patients as they move through the healthcare system.
Well, Captain Dickens, I know that even in recent years, that with technology, that the ability for us to catch cancer in early stages, that has really grown. You know, some of the technology that was not present, for example, back in the 60s when my mother contracted colorectal cancer, there wasn't much they could do. And, of course, some of it has to do when you catch it. But as you mentioned with the colonoscopy, same in my family history. Every 5 years, and it's very encouraging, you know, to get the good report after the fact, even though the procedure itself, as you mentioned, same here. I had the same experience as you did. It was it wasn't uncomfortable. It was, it was something that was okay. And so the question here now is the frustration, I would imagine, with folks such as yourself within the public health community that are concerned that people aren't taking enough of advantage of some of the early screenings. So,
well, yeah, and you bring up several good points. So CDC, the Centers for Disease Control and Prevention, recognize that there are 4 tests that you should get done on, according to the guidelines, and the U.S. Preventative U.S. Preventative Services Task Force are subject matter experts that are convened from around the country that make recommendations as to the type of screening procedures to prevent cancers and other disease for the U.S. population. And one of the things is the mammography. My mother died of breast cancer, and typically when we see breast cancer in African American women, it's one of the more aggressive types of breast cancer that ends in death, unfortunately. But the mammography is one of those testing tools. The Pap test is one of those testing tools, which is formerly the Pap smear. But again, as we talked about, the colonoscopy are one of those tests that's painless, and the low dose computed tomography, or the CT scan. So these are all tests that are not extremely invasive, except for the colonoscopy, obviously. But these are tests that can be done that are relatively painless, that can be performed and used as a screening tool and a prevention tool, because if it's caught early, the chances of survival are much greater.
And I see that about 80% of nurse practitioners actually do focus on disease prevention, and that you actually have a large organization around the country, the Association of Nurse Practitioners. Tell us a little bit about that.
Well, the American Association of Nurse Practitioners is the largest membership organization that represents over 180,000 practicing nurse practitioners around the country. And again, we're an integral part of the healthcare team, working with our physician colleagues and others to provide primary care for patients around the country. And usually we practice in the areas, the community health centers, private practices, all over the country. And again, the association is the largest advocacy group for the American Association of Nurse Practitioners is the largest advocacy group for nurse practitioners, and advocating that we are allowed to practice to the extent of our education and training. And nurse practitioners have advanced degrees in nursing, and many of which, as you indicated, work in primary care. Now, we do have subspecialties in other areas, orthopedics, dermatology, plastic surgery, other areas, but primarily we work in primary care, and that's where the need is for the nation, not only for any individual state, but for the nation. Primary care, there are not enough primary care providers to take on the role of providing primary care to the patients out there in the community.
We're speaking with Captain James Dickens this morning. He is the Senior Public Health Advisor for the Office of Minority Health with the U.S. Department of Health and Human Services. And Captain Dickens, I see that you've traveled just a bit as well. You have served in Africa, also down in the Caribbean, St. Croix, and also in Afghanistan. So, without it taking too long, I suppose, although I have enough time here this morning, what was it like in these other parts of the world? And when you came back to serve back stateside, How did your perspective change when you saw other populations and the health challenges in those communities?
Well, I was very fortunate to be selected to lead a team to Liberia for the Ebola outbreak in West Africa. And it was an emotional event. I mean, the first case was here in Dallas, in the United States on the mainland here. And so as the president decided to ramp up the efforts to support West Africa, we were part of an international coalition, and we ran an Ebola treatment unit. And I had the privilege of serving as the commanding officer, the officer in charge of Team 2 for the United States Public Health Service. And we went over and worked alongside our DOD counterparts from the 101st Airborne, who provided wraparound services for us there. And again, we were able to really help decrease the Ebola epidemic in West Africa. We were just, one wheel in that, one cog in the wheel that provided those services. We worked alongside the State Department, as well as the USAID and their DART team, the Disaster Assistance Relief Teams, as well as the U.S. Ambassador and the President from Liberia and the Ministry of Health from Liberia. So it was a total team effort. And to fast forward, you were saying coming back to the United States, it gave you a greater appreciation for a very complex healthcare system in this country, because there the healthcare system is extremely fragmented and provided by many NGOs, non-governmental organizations from around the world, such as Samaritan's Purse, Doctors Without Borders, and many other countries. And so it was very humbling to see how complex of a healthcare system we have and how fortunate we are in the U.S. And I guess the misfortune about all of that is that we have a complex healthcare system that many of us choose not to take advantage of. And in some of the third world countries, they wish they had the system that we had. And so that's a little discouraging when you come back and you see people that have access to care and don't take advantage of it. And for the ones that don't have access to the care in the United States, it's problematic as well. And certainly the ACA, the Affordable Care Act, has made inroads to decrease vulnerable populations and get them into care for preventative services.
I know, Captain, that for a lot of folks that do have some kind of health coverage, that more services are covered at 100% if they're considered preventive procedures. And I think that that's one of the powerful things in the Affordable Care Act as well. And, of course, not to get too political, but, for example, here in North Carolina, as in some other states, we have not accessed that expanded Medicaid provision with the Affordable Care Act. So there are some North Carolinians that maybe would like to go see the doctor, but have some issues with doing so. But let me ask you about Afghanistan and the women's hospital there in Kabul. Tell us about that, and are things improving for the Afghan people now as far as public health?
Well, again, you're looking at a third world country, and you're looking at a country that has very similar statistics to West Africa. West Africa was one of the countries, Liberia specifically, was one of the countries that had been in turmoil, unrest, or what we call a failed state for many years. And Afghanistan is one of those countries that was deemed a failed state for many years with the Taliban and others. And certainly I don't want to get into the political aspects of that, but I think there were some great strides made in the healthcare arena for Afghanistan. And working at the women's hospital, they had one of the highest infant and maternal mortality rates in the world, which means that if a mother dies and babies aren't living, then the population is going to be decreased over time because of the wars that have transpired. Afghanistan had been at war for over 30 years now, that country, with the Russians and many other countries. It's just one of those, I guess it's called an unconquerable country. And so we went in there, and me being a part of a team, to really train OBGYNs, the obstetricians and gynecologists there, to increase their capacity in country and to increase their midwifery services there, so that they would have people to deliver babies. And there was a place called Badakhshan up near China, in the northern regions, in the mountains of Afghanistan, that they had the highest infant mortality rate in the world, never seen before by WHO, which is the World Health Organization. And so we made great strides in getting nurse midwives back into the community, or midwives, because they were lay midwives, to get them back into the community to assist their communities. And so that was a very rewarding experience as well for me during my career. I think those would be the two highlights, I think, in terms of going to Afghanistan, as well as traveling to Liberia to participate in the Ebola issue there.
And Captain Dickens, on a personal note, I see that you're a graduate of Hampton University, a grade HBCU. Of course, we're here on the campus of St. Augustine's University in Raleigh, so we're kind of all in the same family. And I know are you from Virginia? I guess that's my question. Are you a Virginia native, or is that just where you went to school?
So I'm not a Virginia native. I was a transplant, and I ended up getting my nursing degree at Hampton, as well as my master's as a nurse practitioner, and I have a doctorate currently from Texas Tech. But my home by the sea, I love it, and I'm proud to say that our Deputy Surgeon General, Admiral Sylvia Trent Adams, is also an HBCU grad, and she is a Hamptonian as well. And so we, I love our home by the sea and Dr. Harvey and all the great work that he's done at Hampton. And I'd like to admit that I am a contributing alumni. I contributed to the Alumni Foundation there, and a life member of the Alumni Foundation at Hampton. So the HBCUs have done great work. I advocate for them whenever I can.
That is excellent. Great to hear from you, Captain Dickens, and good work. I see among your commendations, I suppose, is one that's called the Hazardous Duty Award. Now, I'm assuming that came from the work in Liberia having to deal with the Ebola virus. Is that what that's about?
Absolutely. Well, we can get a number of awards for work that we've done, and actually the President Obama has commissioned, along with the Surgeon General, commissioned a new Ebola campaign ribbon that's being developed as we speak, and there's a lot that goes into that. But the Hazardous Duty Awards that I received, believe it or not, some of the time when I first came to Texas, I worked for the Department of Justice Federal Bureau of Prisons. So I worked at a federal medical center. And I know a lot of people think it's Club Med, but it wasn't. It was Club Fed for us. And I provided health care to that vulnerable population, because the prisoners or inmates are still considered a vulnerable population. Because most inmates, as you probably well know, will reenter into society. And so whatever disease processes they have or they've contracted while incarcerated, they bring that back to the community, whether it's TB or some STI, sexually transmitted infection or what have you. They'll bring that back to the community, and so they are considered a vulnerable population. And I provided services there as a nurse practitioner at the Federal Bureau of Prisons, and so I received a Hazardous Duty Award for working in that area, and then I've received one for Afghanistan as well as Liberia.
Well, Captain Dickens, nurse practitioner, I'd say that you have certainly made the rounds, and you continue to service in a wonderful capacity. We appreciate your time here this morning, and I'll let you have the last word here on encouraging all of us to get out there and to get these screenings. So, give it your best sell, Captain Dickens.
Absolutely. Thank you for the opportunity. And again, I would like to just challenge your listeners to, and particularly the males, to go out and seek their nurse practitioners. And if you have a problem finding a nurse practitioner, I would encourage you to go to AANP.org, and that's American Association of Nurse Practitioners.org. Find your local or closest nurse practitioner that's providing preventative health care services to you in the community. In addition, I would encourage all my fraternities and sororities. I'm an Omega man for 30 years plus, a financial member of Omega Psi Phi Fraternity Incorporated, and certainly would encourage Omega Psi Phi to lead the charge in getting the community out and involved and taking advantage of preventative services, and understanding that this is an important part of the process, and it's a modeling process for us as African Americans. So thank you, and I hope everyone has a great week.
Wonderful, and thank you for your time again this morning, Captain Dickens.
Thank you as well.
All right, sir. Pleasure to